Hello, my name is Dr. Khurshid Ghani. I work at the Vattikuti Urology Institute at Henry Ford Hospital in Detroit. I'm here at the Congress Center in Milan for the European Association of Urology meeting, where our group have just presented data on outcomes for percutaneous nephrolithotomy in the United States. Percutaneous nephrolithotomy is the main complex operation for large renal stones, and recently there's been great interest in outcomes for this operation. The Clinical Research Office of the Endourology Society have published on a worldwide series of results for this operation. Also, the British section of Endourology published recently their outcomes of this operation. In the United States, although there have been very large series from single centers on results, there hasn't yet been any contemporary analysis of complications and trends in this operation in the last decade. So we analyzed over an 11-year period from 1999 to 2009 this operation that was coded in a database called a nationwide inpatient sample, which represents around 20% of United States hospitals. And we found some very interesting results. We found that the utilization of this operation has increased over this time. And interestingly, women have now become the majority gender presenting for this type of surgery. When we looked at complications, we found that the complications rose from around 12% in 1999 to just under 16% in 2009. And when we looked at the type of complications that were occurring, sepsis, so infection, which is associated with this type of surgery because sometimes the stones can be infected, increased from around 1.2%, doubled over that period to 2.4%. When we analyzed the type of patients that were undergoing this operation, we found that there had been a trend of more patients undergoing this type of surgery who were older, and also more patients who were sicker, so their comorbidity factors were greater. So we think this operation has become more popular in the US, and it's been utilized in a greater range of patients, including older patients and sicker patients. And this is the first time this has been analyzed in the United States for some time. I think it will be a useful publication to counsel patients what we can expect as complications that may occur after this type of operation. But overall, the surgery is being done well in the United States and continues to be a common operation used by urologists to treat large renal stones.